So my goal, my priority since the start of the coronavirus pandemic has been to be accurately alarmist for the information that we have. And there was a period back in, I think it was December, January, where I was getting emails from people saying, David, you're overly alarmist. This isn't going to be anything. And then there was maybe a little period sort of like in May where I was maybe more optimistic about the situation than some in the audience. But I think that I've done an okay job at more or less accurately communicating the sort of status of the situation and the outlook with the pandemic. And I have what I think is some accurately but cautiously optimistic news for you today. And although the timing of it is interesting, this is not a political comment, but there is a mathematical coincidence pointing to a case and death peak, hopefully the last one of the pandemic, right around the time of Joe Biden's inauguration. Now, I'm not making a political segment out of this. It's mere coincidence. I'll show you the math and the trajectories, but it seems as though right around January 20th, the day that Joe Biden will be sworn in as president, that we will be starting to get past what is hopefully the last peak of this pandemic. And again, it's a coincidence. I'm not claiming January 20th, Joe Biden will be sworn in and COVID will be fixed. It is merely a timing coincidence. And we know that these peaks depend on what happens in the weeks and months leading up. But I want to go through it with you because it does feel like we're starting to get into the tunnel, at least. We're maybe seeing the light or maybe not, but we're definitely in the part of the tunnel that we would consider the latter part of the tunnel. Now, as you may know, we've had 3 coronavirus peaks in the United States. Many countries have only had 2. We've had 3. First one was in April. Second one was in July. And the third one is right now. And in this third peak, we've seen cases spike all the way up to close to 250,000 cases in a single day, mostly in the low 200s, 210, 215,000. And what you can also see when looking at the case graph, if you're watching along with me today, is that over the last 10 days, the rate of case growth has slowed down, meaning the curve flattened, and it even turned downwards in the last few days. Now, it is quite possible that there's still one more peak to go, fueled by holiday and end of year travel and indoor gatherings. We shouldn't do them. It's sort of a foregone conclusion that no matter what I say, many people are going to do them. But the rate of case growth in the U.S. at a large, broad level is slowing down. Looking at the predictions and the models from a variety of epidemiologists and other experts, the case peak is expected to be right around the end of the first week of January, January 7, 8, 9, 10, 11, 12. Very rough estimate. And we know that deaths lag cases by about 3 weeks. And when you look at the deaths chart right now, you see a similar pattern to cases. And while in this third peak, we've started to see the cases come down a bit, we are only seeing the growth of deaths slow down. So we likely are about 3 weeks behind in terms of deaths where we are in cases. So if we see a case peak around, call it January 10th, to pick a date, we would expect to see a death peak right around February 1. In all likelihood, and this doesn't justify getting careless, it doesn't do anything to change the tragic death and destruction that the virus has already brought to date. But in all likelihood, that in January will be the final peak of this pandemic unless something dramatic changes. Why? Because that will not only be the worst moment in terms of weather and people being indoors. December, January is the coldest time of the year in the parts of the U.S. that have winter. But as the temperature warms and the days get longer and people spend more time outside, we will also have the benefit of the vaccination program. Vaccination has started in the U.S. We have the approved vaccine from Pfizer, emergency use approval. Second vaccine from Moderna expected to be approved for emergency use tomorrow. Third vaccine maybe in the first quarter of the new year. So at the same time that we will be peaking in cases and deaths with the coldest weather and the most people indoors, we will have, if all goes to plan, all healthcare workers vaccinated by February 1st, all nursing home residents vaccinated by February 1st, and we will be in the process of vaccinating that next most vulnerable group, which will include the oldest folks and those with the most serious comorbidities. And by protecting an additional 5 to 7% of the population each month starting now, going into January, February, March, that peak we're expecting in January is likely to be the final one and have a more rapid decline than without vaccination. So this is all excellent news, but there is still a big battle here. We're still going to have to do all the things many of us have been doing, not all of us, masks, social distancing, avoiding indoor gatherings. But it is mathematically looking like we're potentially about 3 weeks from the case peak of the pandemic and 5 to 6 weeks from the death peak. And at that point, the vaccination program will be more robust with millions of vaccinations weekly. So there is a light there. That's the good news. Now, given this, we should be extra cautious in these next months because we're so close. It's not like, listen, this is going to go on for 2 or 3 more years, and we might be for psychological reasons, maybe we take a screw it attitude and just have a good time. Starting now, we will see 5-ish% of the country vaccinated each month. That's huge. And we are close to deaths and cases starting to decline. So the message is, that's the math of it. Those are the expectations. That's where vaccination is. We're just a couple months away from significantly better circumstances, my friends. So let's do everything that we can. What if you could read 10 books in just one sitting? That's exactly what one of my favorite apps lets you do. It's called Blinkist. And what they do is take thousands of popular nonfiction books. They condense them down into text or audio that you can consume in 15 minutes. Blinkist makes sure that you're getting all of the important core insights from each book. So it's perfect for exploring a book you otherwise wouldn't have time for. If there's a full book you're thinking about buying, you can use Blinkist to get a sample first. Just think how much you can enrich yourself by being able to soak up an entire nonfiction book in just 15 minutes. I recently checked out the book Podcast Marketing Strategy by Daniel Rolls and Kieran Rogers, and so useful, so particularly applicable to what I'm doing. Really recommend it. Blinkist has books on politics, philosophy, science. They have 27 different nonfiction categories, and a subscription is only about $8 a month, and you get the entire library. But you can try it totally free and get 25% off a subscription when you go to Blinkist.com/Pakman. I've put the link right underneath this video.